Welcome to Thoughtful Thursdays. Today we're talking about geriatrics, and we have with us Dr. David. Dr. David, can you please explain what is geriatrics? What does that mean?
So geriatrics is basically the care of older people. So internationally it's counted as people 65 and over, but in some other countries in Europe now it's 75 or over, or even 85 and over. But it's basically people who are becoming older and looking at their holistic healthcare. So instead, maybe if you were younger, you would go and see the cardiologist, the heart specialist about your heart, or the kidney specialist about your kidneys. Whereas when you're older, all of these problems interact, and it's a specialty looking at the holistic care of the person involved rather than just one aspect of it.
So why would older people need a specific general doctor? Why couldn't a general doctor just do all the ages?
So specialists in geriatric medicine go through extensive training focused on people in the older stages of life. And it's, in children's medicine, children are different to adults in the way they behave, in the way diseases affect them. And it's the same when you start to become over 85. The way diseases affect you is very different to when you're younger. And so there's a lot of specialist training and expertise in trying to manage that. And also many people come with multiple problems. So one of the medical terms we use is comorbidity, which means you actually have lots of illnesses competing for attention rather than just one. And specialists in geriatric medicine best at prioritizing which is the most important to treat and how to avoid harm from any of the medications or the treatments or investigations for many of the problems.
So are there conditions which are really specific for geriatrics, which you don't see in other patient categories?
It's more about how people come to hospital and need medical attention. So say if someone has a problem with their heart, they may come with chest pain and be very unwell. When you're older, you might feel ill, you may become confused, you may have suffered a fall, you might just feel very tired, or all these things. And so geriatrics is particularly expert at looking at these areas like why have you fallen, why are you confused, and then we do very intensive tests and look at the whole person to find out why.
Yeah, I was thinking about, for instance, dementia. You would not very likely see that in younger people, but it must be quite prevalent in your population, I would think.
Yes, so dementia is an illness where you have problems with your memory, mainly, so you forget things, particularly the short-term memory, but it can also affect other areas of your well-being, like your ability to go out. Sometimes people find themselves getting lost all the time, or sometimes people can't do all of the things they normally do in life, like their banking, shopping, things like this. And dementia is, has many, I suppose, different types. So you have the overall bracket of dementia, but there's many different types in that. And the investigation of treatment is very specific for them. So this is an area where we have a lot of expertise in seeing people who have these symptoms and finding out if they may or may not have dementia and helping to provide care for them.
Yeah, that's very interesting. Thank you. And how long have you been a geriatric doctor?
Probably, I started my training in geriatric medicine in 2012, and I've been a consultant in geriatric medicine since 2017. So I've got quite a lot of experience now.
So is there a connection between home care then and geriatrics?
Yes. Yeah. So I think, at Mediclinic, we're looking to expand our home care services specifically for the older age groups and pioneers to try and keep them in their own home for as long as possible and as well at home as possible.
Yes. And I assume there's also a relationship between geriatrics and the long-term care department.
Exactly. Yeah. So unfortunately, as we age, many of the conditions we have as health conditions, they can't be cured anymore, but they can be controlled, and your healthcare can be optimized to get the best version of yourself. And naturally, we thought if you're getting some of my patients, if I write a problem list, they will have 9 or 12 significant medical problems. Then they're all long-term conditions that need management.
What would you say we would need to do here in the United Arab Emirates to be prepared for the future when it comes to geriatrics?
I think often in my day-to-day life at work, often people have never thought about what they want to happen when they become older. But I think one of the main ways people could prepare is just to be aware that things change as you age. You can still live a very full and happy life to a very old age. Some of my patients are 90 or 100, but to think about, when your health deteriorates to a point where, would you want to be artificially fed?
Yeah, and another thing you might want to do is early detection of diseases, I would think.
Yes.
Screening, is that important?
Exactly. So prevention is the best form of cure. And so we have a healthy aging screening program we run where you can come. We actually start at a younger age, so even people 50 or above. We have a specially tailored program for screening for common illnesses, common risk factors for other illnesses. And this is the best time to try and address your health rather than waiting until a problem hits. Actually, if you take measures to improve your lifestyle, control your risk factors for disease at a younger age, actually you're preventing major problems in later life. And that's really a lot of our push is in this area to try and help people.
Are you talking about, for instance, being overweight, diabetes, or what specific things would you say people should look into early in order to prevent problems at a later age?
So one of the main risk factors for people is to be overweight. So obesity, which is being significantly overweight, is a major risk factor for almost every health condition. So if you can manage your diet and weight to keep it under control or lose those few extra kilos of weight you may have gained since you were 30 to 50, this is one of the best ways to keep yourself healthy, but also healthy exercise, so regular walking or going to the gym. If you smoke, you should really give up smoking. And just trying to keep as healthy and active as possible. Other risk factors is for a condition called diabetes, which is where you have high sugar levels in the blood. Another major problem is high blood pressure. So actually my Emirati patients are fantastic at complying with blood pressure control. They're really good, but it's something to think about. If we can control your blood pressure, this reduces the risk of heart disease and strokes in later life, and also conditions like dementia.
It's interesting that you should say that they're specifically compliant with antihypertensives or like medicine against high blood pressure. Why do you think that is?
I think it's my experience of the Emirati population is they're very proactive in their healthcare and very proactive in taking care of themselves, which makes my job very easy. I don't have to persuade people to take, some tablets. They're very open to it.
Do you feel that in this setting where you are, I called you a pioneer in the beginning when we started talking, and the more we talked, I actually see you even more as a pioneer. Do you think that we need to start bringing geriatric specialists from all over the world to the United Arab Emirates, or is it a little bit too early for that?
I think it's very early. I think by the time the years tick round to 2050, more and more specialist geriatric doctors will need to be employed to work here. The best thing would be is if we can train their own local population. We've got a collaboration with Mohammed bin Rashid University in Dubai for training the medical students there. If we can persuade the local population that geriatrics is an exciting specialty, which is a major challenge, even in my own country, it's a challenge to attract people into it. But it's honestly, it's the best specialty to work in for me. It has all of the aspects of medicine that I enjoy, like the personal side, the holistic care, and it's very individualized, and you get to meet people. I've met people who have worked in different capacities in the government. In the UK, I've looked after people who were nuclear physicists, invented different medications, all these sort of things. It's a fantastic privilege to meet people in later life and hear their stories.
That's wonderful news, and I think this has been a very interesting conversation. I'm very thankful to you for giving your time to us and your knowledge and your insights, and I hope that everybody who's been listening has been enjoying this episode of Thoughtful Thursdays. Thank you very much.
Thank you.